Hey everybody, welcome back. So today I'm going to be doing my 1 month update for my clinical experience. I can't believe 1 month is gone. It's like it's going by so fast. So basically I'm just, getting used to everything, getting acclimated to the floor, to the office, basically integrating clinical into my life. It's a huge adjustment. I'm spending more time away from home. My kids are in daycare. It makes my life super hectic, and I just see my planner just filling up more and more, and sometimes it's so hard to keep track of my schedule. I'm doing a lot, y'all. I'm doing a lot. But it's going to be so worth it in the end. I'm learning like tons. It's so fun, but it's so stressful at the same time. It's so hard to explain what I mean. It's fun learning stuff, but when you don't know it, it's such a blow. I mean, it's such a blow to like my ego. Sometimes I feel like a total and complete idiot. But that's to be expected a little bit. You can't know everything, and I think that's my hard part. The hardest part is transitioning from being a nurse, where I'm considered the expert, to the student nurse midwife, where I'm a novice. I always have that hard time when it's time to transition from one thing to the other. I'm used to, or I always want to be the best at what I'm doing. And in the beginning, you can't be the best. You know what? Especially in a field like this, an advanced practice role, you can't be the best starting out. You cannot be the best in clinical, like seriously. Because if you were, you'd already be the provider. That's what I have to keep telling myself. But I'll get over myself. Like I said, it's the ego, So majority of my time I've spent doing hospital calls. So what's that? It's a 12-hour shift on labor and delivery at the hospital. So I'm here taking care of patients, or either waiting for patients to come in, because every time I get here, there's no guarantee there'll be patients on the floor. So I do get to come in the call room and study or do work, mostly working on soap notes. You didn't see that, but yeah, I've done majority of hospital call. Now I've had a couple days in the office. So the office is an 8-hour shift, and that's been a little bit more difficult for me. You know what, both of them have been difficult, but the office has been a little bit more challenging, because I'm familiar with the labor and delivery, environment. Not being a provider, but just the workflow, and I have an idea about what the midwives do. I see them work. I might not see the back, the behind the scenes of everything, but I'm just used to that environment, and some of the stuff that we're doing I'm familiar with. As opposed to being in the office, I've never had that type of job before. And the only time that I ever go into the office is a patient myself. So for a GYN visit, or when I was having my children, prenatal visits. So that's been a little more challenging. I think the main reason is because the classes that are associated with doing the office work portion of my clinical, I took a while ago, like a couple of semesters ago, which was like GYN and the antenatal course. That was like in the beginning of the meat and potatoes type of courses. If you want to hear about when I took those courses, I do have a video for that. I'll try to link it above so you can check it out. But I do have videos doing updates during my didactic portion of the course. So if you're new to my channel, check those videos out. There's a playlist of all the updates. And yeah, anywho, back to everything. The other challenging thing is transitioning roles. So transitioning from being a nurse to an advanced practice nurse, from where you used to take orders to now being the person who's giving orders. Oh my God. And then you have to justify why you're giving these orders and then document them in the correct way. I have some very supportive preceptors that's kind of guided me along the way and helping me feel more confident and comfortable in this new role. So I'll get there. It's only been a month. It's only been a month. So speaking of it's only been a month, I had my 1 month evaluations. So my school requires that we do monthly evaluations. So I met with the director of the midwifery department here, and she took an eval from all of the preceptors that I had and kind of combined it into one. And you either meet or you don't meet expectations. So it's like one form that's used throughout the whole clinical portion. How do they expect you to get all those boxes checked off, especially after 1 month? They don't. But you do have to get a certain percentage of the boxes checked off to be able to pass. And I did get a lot of them checked off. The majority of the ones that I did not get checked was due to me not having a lot of office clinical time. So I'm going to focus on, you know, perfecting those things and getting those office hours in. I do have a couple of office days scheduled, and then I'm going to have a 2-week follow-up with the director. She did say my evaluation was good, but you know, all the boxes are not checked off. I don't like it. I'm one of those people, y'all. I am one of those people. I want all the boxes checked off. But like I said, it's only been a month and I can't expect to get all of them checked off, but trust and believe I'm going to get there. You better believe it. I ain't do all this for nothing, okay? Okay, so let's get to the good stuff. If you've seen my previous video, certified nurse midwife versus women's health nurse practitioner, you kind of get an idea of what I'm doing exactly in clinical, but let's break it down. Let me give you an overview. Okay, so a typical office day for me is I see anywhere from 12 to 15 patients a day, and that's a busy day. Sometimes they all don't show up, but that's okay. But that's usually what the schedule is. I see GYN patients, woman exam patients, or people that's coming in for contraception, people that want to discuss preconception, perimenopausal and menopausal women. I mean, women coming in for prenatal visits, coming in for postpartum follow-up visits. Let's see what else. I think that's really it for the office. Yeah, so like I said, I see these patients along with my preceptor. Right now, they lead more of the questioning aspect. I do get the history, but they lead more of the questioning just to make sure I'm hitting all the things that I should be asking about. I do majority of, well, I actually do all of the physical exam part. They do it as well. But other than that, I get my hands in there. You know, I'm measuring the size of the fundus, taking the Doppler to the belly, listening for fetal heart tones. I'm doing pap smears. I'm doing just regular vaginal exams. I'm doing full head to toe assessments sometimes if they're new, a new patient to the practice. Let's see, STD testing. We do look at some of the specimens under the microscope. Others we send out. That's pretty much it. That's pretty much it for the office right now. On labor and delivery, we triage patients. We make the decision if they're going to stay or go home. We see just laboring patients, of course. We have patients that are coming in for inductions for different reasons. It can be for preeclampsia, just hypertension, diabetes, macrosomia, a multitude of reasons. of course, we're doing birth. And after they deliver, I get to do the postpartum follow-up visits that we do inpatient, and then the newborn exam. And then we see them on like postpartum day 2 as well. So we prepare the discharge and do a lot of education as far as taking care of themselves when they get home, taking care of the baby, when to follow up, and a lot of safety things. And we also talk about breastfeeding, and then further family planning as far as like contraception or things like that. That's pretty much it. So the moment that you've all been waiting for, I know you want to know. Hopefully you guys have been counting down with me on my social medias, my Snapchat, Mommy Nurse Makeup, without the E, and my Instagram, Mommy Nurse Wife Life, just to keep track of which number delivery I am at. So without further ado, I am on baby number 6. It's going by so fast. I didn't think, you know, I actually got those 6 births in the first 3 weeks. That is, I mean, that was fast for me. But I'm excited. I have to get to 40. There are requirements, even for all of those type of visits that I told you I see in the office and on labor and delivery. There are certain numbers of each type of patient or encounter that I have to get, and 40 is the magic number for births. The most exciting part for me. But that's it. Like I said, thanks for tuning in. If you're new, don't forget to subscribe to my channel. If you have been with me so far, thank you so much for the support. Leave me some feedback below. Send me all your well wishes and blessings, because I could take it right now. And I'll see you next time. So